The one thing medical experts and government leaders say is needed to even attempt to restart life: rapid testing. I talked earlier this afternoon with infectious disease specialist Dr. Stephen Thomas of Upstate University Hospital about two huge developments in that area: rapid testing and now their ability to process their own tests.
It's really important for lots of reasons. So one reason that it's important is obviously to protect our healthcare workers. So as soon as we know that somebody is positive or not positive, we can properly disposition those folks to certain sections of the hospital. That's number one. Number two, trying to conserve PPE is a daily battle. It's just so important, and we see a lot of course, national news regarding the PPE shortages around the country. And so as soon as you know that somebody is negative, then you can kind of stand down a little bit on the types of PPE that you require to care for those patients. The third is that from a more of a public health standpoint, the sooner that we can identify somebody as a positive, the sooner that we can inform the Department of Health, and then the Department of Health can do those public health interactions, which are really fundamentally what is going to allow this to stop, basically, is that them identifying who's positive, being able to go to their house, identify who the contacts are, and get people quarantining and isolating as appropriate.
So we have seen from testing to result drop as this has gone on. How much quicker can you guys turn these test results back?
That's a good question. So when we were sending our samples to Wadsworth, initially it was about a day and a half turnaround time. But then as more and more tests were coming into the Wadsworth laboratory, it got up to almost 3 days. So now we have the ability, we have two different tests. We have a rapid test and we have a more traditional test. The more traditional test brings us from the Wadsworth 2 to 3 days to less than 24 hours. And then the rapid test, which is for very specific circumstances, that's less than an hour. So the throughput really for us has increased quite a bit.
That's for specific uses, though, still only very select uses, the rapid test, right?
So yes, we have very specific populations. So these would be people that primarily are going to be inpatients in the hospital. These would be certain patient populations where knowing sooner rather than later could impact the clinical care that these patients receive. So those are just kind of two examples.
And maybe last thing for you here, just so that we're clear with everybody out there, just because you have these two different types of tests doesn't mean that anybody that thinks they need to be tested for COVID-19 should suddenly show up to Upstate, right? Where should they be going still?
Right. No, so I appreciate that. Yeah, so there's two elements to that question. The first is we are still only testing people whom a medical provider believes that they need to be tested because they believe they're at great risk of having been infected or they're demonstrating symptoms of having been infected. So that's number one. Number two, nothing has changed in terms of where you go to get that guidance and where you go to have that test performed. People should still keep going to the Syracuse Community Health Center. They should still keep going to their primary care provider. If those providers have the ability to take the sample and order the test, they should still continue to do those things.
Dr. Thomas, as always, thank you so much for your insight, especially on these two new developments here.
Thank you. It's very exciting.
As I said earlier this afternoon with Dr. Thomas, if you develop symptoms such as fever, cough, and/or difficulty breathing and have been in close contact with a person known to have COVID-19, stay home, call your doctor. If you don't have a doctor, call the Upstate Triage line, 315-464-3979.